pictures here. I've got a pump for you to look at. This is the pump that he would want to use for you. So this is the pump itself. You can hold it. So that's what goes in the heart. Okay?
My glass, Jeannie.
You got it? So what it does is it goes inside the heart and it just kind of bypasses that left side. So it helps the left side of your heart to work better. It does some of the work of the left side of the heart. So blood would go in through here and spin around, and then it comes out through here and goes up to the aorta. So it just bypasses that left side. That means that the right side of your heart still has to work. So we know that with heart failure, it's usually both sides. There's varying degrees of how bad your heart failure can be on one side or the other. So that's why we've been doing all this testing to kind of see how your heart's working and how the rest of your body's working too. Okay. We expect that this is kind of a turbocharge for the left side of your heart. So we expect that the right side is going to be a little bit slow to keep up with that, and there are things we can do to help you through that, and I'll kind of go over them. But we'll just start from the beginning with this binder. So the first part of this is what is an LVAD. So it talks about, and this is for you to read later, but it talks about that it's a blood pump that helps your body. It's connected to a controller, which is that, and it needs batteries to run. So that'll all be equipment that would have to be carried around all the time. You'd be connected to it always. Okay? There's two reasons primarily that we do it. One is bridge to transplant. That's for people who are already on the transplant list, heart transplant list. And they just can't make it to the transplant for whatever reason. Then there's destination therapy. So that's anyone who's not actively on the transplant list, which is you currently. So that means that if for whatever reason a transplant is not a good idea for you, you will have this for the entirety of your life. You know, the LVAD for the rest of your life. Okay? So the reasons we do it, it helps your heart failure, helps you with your symptoms. So helps your breathing, helps you be able to walk further, all of those things, which improves your quality of life and gives you a longer life, because of course heart failure is a fatal disease. We know that. So it increases the survival of your life. Okay. Risks with the surgery. No, it's a big surgery. It's a big heart surgery. You've had heart surgery before. So, same idea. They go through the chest the same way. And then this is connected to a white cable. Looks kind of like that comes out your belly and connects to this controller. Okay? It's a pretty big surgery. With that, you've been on some blood thinners previously, right? Yeah, so bleeding is a big risk with this surgery. So we're stopping some of those blood thinners, changing them around to things that we can reverse at the time of surgery. All right, so you'll see some changes to your blood thinners. Infection is a risk. You're going to have a line coming out your belly that needs a dressing change, a sterile dressing change, at least once a week. And so with that, it puts you at risk for infection because it is a line that goes all the way up into your heart. It's not like this PICC line where if it gets infected, we can take it out and switch it. It's there for good. So we have to be really good about taking good care of it. Okay? And we teach you how to do that. Blood clots are a risk. So this is a metal piece of hardware sitting inside your heart, and your blood doesn't like to touch anything foreign. So when it does touch things that are foreign, it likes to clot up. So you'll still be on a blood thinner after surgery. It won't be Eliquis or Xarelto. Some of those new ones, it would have to be warfarin. Unfortunately, that's just because we have the ability to reverse it a lot easier. So blood clots are a risk. Stroke is another risk, both bleeding and clotting, because there are two kinds of stroke. So the clotting, again, because this thing can make clots and then send them to your brain. And then again, bleeding, because you're going to be on a blood thinner. So we keep you in a tight range. The normal INR goal is 2 to 3. I don't know if you're familiar with INRs. That's the blood level that we draw to make sure we're giving you enough, but not too much blood thinner. So we keep you in a tight goal, keep a close eye on it, but it is a risk of having this pump. Kidney failure. Now you already have some problems with your kidneys, is that right?
They said I did.
Yeah. So putting this pump in requires you to go on the heart-lung bypass machine, just like you did for your bypass surgeries. That can cause damage to your kidneys just because of the mechanism of putting you on that pump. So it can cause some kidney failure in the meantime. Now that's not always permanent. It can be temporary, but sometimes it is permanent and it requires dialysis. that's something we talk about ahead of time. And I'm sure Dr. Maliala, as we get closer, is going to talk about how your numbers are looking and what he expects and all those things. He's pretty good about kind of predicting who's going to require those things. Okay. And then failure of the VAD. So this is an electronic, essentially. This is a little tiny computer that gives that pump information about what it should do to run. So there always is a risk that it can fail. It's very, very uncommon. But what we do to help with that, you take a second one of these home. So you're always going to have a second one as a backup that you can switch to if that one stops working, the one that you're currently using. Okay. So we'll talk about those a little bit more after the surgery and what we do to prevent them. But those are the big risks. The other thing, like we talked about, is that right side. If your right side doesn't keep up, we have to do things to help support it. So sometimes that's the milrinone, the same medicine that you're on right now, helping your heart squeeze. When you come out of surgery, you'll still be on that, and that's just to support the right side of your heart because it's used to keeping up with a failing left side, like a Model T car. When we put this turbocharger in it, it doesn't always pick up right away. So we're going to support it. We're going to keep it on that milrinone. If your right heart struggles even more than we expect it to, and we can't support it with just milrinone, there's an inhaled medication that we can give you as well after surgery. We go through the ventilator because you would come out on the ventilator. If that, again, is not enough, we can do what's called an LVAD. So this is an LVAD, it supports the left side. We have what we call an LVAD, which supports the right side. Now that's not something you can go home on. That's 2 big tubes that circulate your blood and support your body temporarily until we can get things perked back up enough. Okay. It's a lot of heavy information, so you tell me if you need me to slow down. Okay. This is a list of what we need you to do when you have an LVAD. So, of course, we'll know your whole medical history. We'll need you to follow directions for what we tell you to do and keep your doctor's appointments. And we want to get you back to more of a better physical state and being able to walk a little bit more, okay? These are our phone numbers, both the office number and then our emergency cell phone number. One of us is on call 24/7, 365 for any emergencies that you would have with the pump at home. So, for example, I'm on call today. So if anyone has any problems, they can call a cell phone directly and get a hold of one of us immediately for emergencies. Okay. And then you've got the office number that helps with medication refills, appointment times, things like that. And you don't have to remember all this right away because we'll go over it again after surgery. Okay? So this is who's a candidate for an LVAD. Someone that has heart failure that's causing problems to other parts of your body because the heart failure is so severe. It's not moving blood and getting nutrients and oxygen where your body needs it. So this isn't for someone who is doing fine with their heart failure. This is for someone who's been in the hospital a couple times, feeling worse, feeling more sleepy, feeling more sluggish, struggling with their heart failure. Okay. This is the list of tests that we do to decide if an LVAD is right for you, and we've done these things and looked them over. I've looked them over, Dr. Maliala's looked them over, Dr. Anaya and the heart failure team have looked them over, so lots of people making sure that this is a good idea. Okay. So these are all the tests that we do. This equipment and the surgery itself is not cheap, so we make sure that we check with your insurance. Now, are you Medicare? Yeah, okay, so they take care of all that, but our support person makes sure that it's approved by insurance, that everything's good to go before we start the process. So that's also part of it. If that's ever a concern, we also have financial counselors. If it gets to the point where the medications are expensive, now they're just the same heart failure medications that you've been on. Nothing should be too big of a shock. And warfarin is an old drug; it's pretty cheap usually. But it's not like the new ones, the Eliquis and the Xarelto. Those are more expensive. But if that becomes a problem at all, please let us know because there are things we can do to help you with that. Okay. You'll see a nutritionist, psychosocial people to make sure that you're in the right state of mind for this and that you're giving your body what it needs to support you through a surgery like this. Okay, so you see all those people. This is just a little blurb about research. So, of course, we're an academic hospital. LVADs have been around a while, but they're constantly changing. So there is a database called InterMax. It's a registry of all LVAD patients that you would be entered to. It doesn't tie your information necessarily to you, but it's just so that we can track outcomes and complications and things like that and learn from them. Okay. So this is the process of how the whole thing works. So before surgery, you would go to the ICU with a line in your neck. That's how they do the right heart cath. So they put a line in your neck that measures the pressures inside your heart. So we can leave that in the ICU and measure that to make sure that you're in the best shape possible from a heart failure standpoint going into surgery. Not too much fluid on board, not too dry, those kinds of things. Okay? So that would be the case before the surgery. Then you would go down to the OR where we would do the surgery itself, and then after surgery you would go right back up to the ICU. No time in like a PACU or a holding recovery room. The ICU is your recovery room. When you first come out of surgery, you'd be on the breathing tube still, have a breathing tube down, be on the ventilator. And that's just normal surgical recovery for something this big of a surgery. Okay. Do you remember that from having your heart surgery? Same thing. Okay. Have lots of lines and tubes, lots of medications running to help support your heart and get it used to this LVAD. Lots of dressings and all of those kinds of things, and it kind of spells those out in there. Be on a heart monitor just like you are now, all of those things. After your recovery, so you'll stay in the ICU for a period of time. Hi. After that recovery, you'll come right back over here. So after you're in good enough shape that you no longer require ICU care, you come back over here. And that's where we really start to teach you how to take care of this at home and how to do those dressing changes and all those things. A lot of that happens here. Then this is information about leaving the hospital. So you'll have our contact information. We wouldn't want you to drive right away because you've just had big heart surgery. Same thing as before. Not lifting anything heavy for a period of time. Still those same heart failure things. I still want you to weigh yourself every morning, keep an eye on your fluid status, fluid restriction. None of that goes away. Okay. We'll see you in clinic pretty regularly here. So after surgery, we would see you within a week of going home in clinic to make sure that things are going like they should. And then that will advance out from there. The longest we usually go without seeing you is 3 months, and that's once you're pretty stable and comfortable with your equipment. Okay. These are pictures of drive lines. These over here are kind of not pretty. We want it to look like this, nice and well healed. Over time, that tube coming out of your belly, your skin will heal up around it and it'll close up. If it ever looks like any of these things, those are things we want to know about because those are signs of infection. There's drainage and redness and all of those things. This is talking about your diet. So right now, you've been on a blood thinner that doesn't require as much work as warfarin or Coumadin does. They're the same medication. Coumadin is affected by vitamin K, so that's something that you get in your diet from dark leafy greens, or broccoli or Brussels sprouts, dark green things, vegetables. The more you eat of those things, the less the Coumadin works, so it makes your blood thicker. And we want it to be at least a little bit thinner. So that's just something to know. It's okay to still eat those things, because of course we want you to have a heart-healthy diet, but we just need to eat them consistently. So if you're going to eat dark leafy greens, try to eat them regularly so we can keep a steady blood level. Okay? And those are just heart-healthy information. These are reasons that you would call us. So like I said, there's one of us on call 24/7, 365. So those are reasons you would call us. If you notice any of these things happening at that driveline site, so drainage, redness, itchiness, burning, signs that there's some infection in there. We want to know about it pretty quickly. If you have a fever, if your blood pressure is high or your heart rate is high, or if you notice a change in how your VAD is working, change in the numbers, then we'll teach you how to look at those. These are our phone numbers again, and before you go home after the surgery, we would make sure that you would have all this information in lots of different forms. So we give you magnets, luggage tags, lots of ways. This is a list of our team with all of our names listed there. And this is a spot for you to write any questions that you think of. So, of course, we'll still be around. Angie and all the nurses know how to get a hold of us. So if you think of questions, write them down and have her get in touch with us and we'll come talk to you, okay? We're here Monday through Friday, 8 to 4:30, and then we'll have us on call.
Okay.
So the equipment itself, this is the pump. So this would be inside. So you wouldn't see this on the outside, but that's what it looks like. It's pretty light. It's the lightest one on the market. This part up, that would be inside the heart, and this would be attached kind of right on the outside, so you can see that picture there. It's right on the outside of the heart. That line comes off of it and goes down to about there, and that comes out your belly. And from there out you would see. So it would connect to this controller here. And you can touch that too. Compared to a lot of the controllers, it's actually lighter. And then these are the 2 batteries, so you would be plugged up to either 2 batteries, make you pretty mobile and carry all that around with you, or wall power when you're sleeping, just to make sure that you don't miss an alarm that those batteries are going dead. It's always 2 power sources, and then the drive line. So all of that equipment would get carried around with you. What do you think? Seem like a lot at the beginning?
At the beginning, but
Yeah. Get used
Eventually
to it.
you get
yeah.
used to
Yeah.
it, and it
Verify.
becomes part of you. But it is a lot to take in at first. Now we do have a support group, so they meet quarterly. We usually make it on a Friday because that's when our clinic visits are. So that way we can catch you when you come to clinic. But every 3 months or so, you can meet other people with a VAD, see how they do with it.
yeah, I'm sorry.
No, you go ahead and move. I'll follow you anywhere you go. You just touch anything you want to touch.
Battery.
Those are the batteries, yep. So they're specific to this. It's not just a battery you can buy anywhere. So we send you home with 6 of these, and they work in pairs. They give you 4 to 6 hours a piece. So 8 to 12 hours a pair. You go home, like I said, with 6 of them and a battery charger, and then you also get the wall power, and you get the car power too, so you can plug into the car if you're going on a road trip or anything.
A lot better than dying.
Well,
Yeah.
those are always the options that you have to weigh, huh?
Yeah.
But we can do it.
Hmm?
And so we can get it done. We can do it.
Yeah.
Yeah.
So the biggest things, of course, you got the equipment that you're carrying around forever and ever. Weekly, we need to get a blood level to check on that INR to make sure we're getting you the right amount of coumadin. So at first, that's going to be with home health when you go home. They'll come and see you, draw your blood, and send the information to us. After home health's done seeing you, after you're well enough to not need them anymore, you can go to any lab that you want. And eventually, once you're on warfarin long enough, we can get you a meter where you can check it at home. It's just like checking a blood sugar, but it takes
Okay.
a while to get that approved by insurance.
Okay.
So for the time being, you would just go to a lab. Okay. Any lab, and they can send us the information. So getting that blood level drawn once a week, and then changing the dressing once a week. And those are the 2 big things, and then the equipment. How do you feel about it?
I'm all for it.
Okay.
Yeah.
Okay. What questions do you have about it? Anything you can think of right now?
No. Oh, there's 2 batteries on there all the time.
Yep, 2 batteries all the time, so they plug in there and there,
Yeah.
and then that cord, the drive line that comes out of your belly, that plugs in there. When it's on, you won't have anything here. This is just a silencer while it's off.
They put
Go ahead, you move. I'll
they
follow
put
you.
that in the heart.
Yep, this goes right up in the heart. This right here. So this part's what's actually in your heart. They have to core out a little bit of a hole to put that up in there. And then it seals around it. They sew it in, so it can't go anywhere. It's sewn in. This part's sitting right on the outside of your heart. And there's a tube that comes off here that goes up to the aorta. In this picture, this white tube here that goes up to the aorta to move the blood and send it out to your body. Then you've got a cable that connects there. That's this little cable here that comes out of your belly to connect to all this equipment, to give it power to run and to give it the information to know how fast to run.
That's amazing.
Mm-hmm. They've come a long way with what we can do.
Amazing.
Mm-hmm. what does your family like? Tell me who lives kind of nearby you. Does anybody live pretty close?
There's 5 doors and one next door.
Yeah.
Okay, that's
So,
perfect.
yeah. So I'll be there constantly with him.
Okay.
So yeah.
So at least for the beginning, that's really helpful.
Yeah.
To have someone there pretty regularly until he gets used to this equipment
Yeah.
and gets, strength and dexterity back because it is a big heart surgery. I don't know
Yes.
if you remember his last one. That's important to have somebody around, and then also somebody who can change that dressing for him.
Yeah. Yep.
Now he will be able to shower with all this equipment. That's something
Okay.
that we'll teach you how to do before you leave, but we won't want you to do it until after your first clinic visit with us to make sure everything's healing up before we let you get in the shower.
Okay.
So in the meantime, it'll be kind of a little bit of a bird bath kind of a thing, wiping off and
Oh, that's fine.
cleaning up that way. But you can shower with it eventually. We give you the equipment to do that. The dressings get shipped to your house, and they come in a full kit. We teach you how to change it.
So you don't never get to worry about him running out of the bandages and stuff like that. They always come, or
They should ship at regular intervals, and then you get their contact information. You just let them know when you're running low, and they'll ship you a new shipment.
okay, all right,
We'll get you started, and then it's just keeping up with them. That's all. So when you get down to a couple, I'll call.
okay,
Usually they can ship them out within a couple of days,
all right,
and it's a weekly bandage most of the time. But
okay.
they're fairly good about it.
Won't you look?
Yeah, all right.
I wonder if they can see all that.
These are actually pretty light compared to. There's another manufacturer. The batteries are a little bit bigger. The pump's about the same. They each have their own features, but these are actually lighter batteries. The connections are fairly easy to make, so even if you don't have the hand strength, you don't need it. It's simply plugging it in.
So this goes into the
Yep.
battery,
So
and this goes into the stomach, right?
Yep.
Okay,
You've got it right, and then nothing would be here.
okay, all right,
Yep. So you'd have two of these plugged in there and there,
okay,
always. So this doesn't have a backup battery in it. So if it lost all power, the pump would turn off. It wouldn't have any power to it.
Hmm.
So that's why two batteries, always change one at a time.
okay.
Okay.
Both of the batteries lose or charged at the same time, or
It pulls from one at a time. So when they're plugged in, it'll tell you if it's pulling from number 1 or from number 2, and it'll tell you how much each one has. Those blocks light up green, just like this. So that one right now is 75% charged.
huh,
This one is 100%.
huh.
So it will pull from one at a time. Once this one gets down to 25%, it'll automatically kick over to the other.
Oh, okay.
Once they both get to 25% apiece, it'll alarm, it'll make a little noise and light up to tell you that your batteries are low and it's time to change them. So you still have plenty of time left on them when it does that.
Okay.
And then if you ignore it, when you're getting really low on your battery, it'll alarm again.
Okay. All right.
But it really tells you kind of what's going on. If there are any alarms as far as problems with the machine, or the flow that's going through it is low for any reason, your blood pressure or your fluid status or any of those reasons, we'll talk about those. This is just the beginning, but if any of those things are happening, this screen here will tell you. So there'll be 2 lines here. The first one will tell you what the alarm is. So for example, low battery. So it'll say battery 1 low or something to that effect. And then the second line will say replace battery. So it'll tell you what the problem is and then tell you what to do about it on my second line. It's pretty user friendly. Makes noise to catch your attention. It's got a speaker on there, makes noise, and it lights up to give you that.
Oh, well.
Okay. I'm going to answer this just really quick. Okay, and I'll be right back in.
You okay with it?
Yeah.
Yeah. We can do it though.
Huh?
So we can get it done though. We can learn how to take care of it and all that stuff. So yeah. good though that it alarms and stuff and let you know when to do it. I thought she said them was light. Them's heavy.
Mhm. You get a shoulder strap belt with him mount on.
Yep. Yeah. They'll give you something to put it in, but yeah. So that goes into your heart, and this is the battery and the battery part there.
Yeah.
You have to keep it clean and batteries charge it up, and you're ready to go.
And they send me the stuff to clean.
Yep. So you don't know how. Just when you get low, just call.
Huh?
Just call them when you get low, or have one of
I
us
think
call
they
them.
just send them to you. The way she talked.
Well, so yeah. But we'll look over that book and stuff, and then all of us will look over it and get it done.
That big part goes up in your heart.
Mm-hmm. Yeah. That's what.
Huh.
So it's gonna go like
Yeah.
that. It'll go like that then.
It goes up like this.
Okay.
To the bottom.
Yeah. Goes like that, and it's at the bottom of the heart, and then everything else hooks from these.
The water that comes out your belly comes out of here.
Yeah.